Hey guys, Andrew Donadio from MedSurg 1 over at Cumberland University. All right, so I was going over some stuff related to some care plans and trying to make things easier to understand for people. All right, again, the whole nursing diagnosis thing, it's a starting point. Very few people use nursing diagnoses, the NANDA description. You're not going to see it on the NCLEX. You're not going to see it when you get into practice, but what it does is it's a starting point. It lets your teacher know that you have identified what this patient's primary problem is. All right, so right now I'm using the Lewis book, 9th edition, okay, MedSurg Nursing. All right, and I'm going to go over some basic concepts of care planning. All right, so if you go to page 5998, okay, and we're talking about patients with chronic obstructive pulmonary disease, bronchitis and emphysema. All right, so the problem that you've diagnosed for this patient is ineffective airway clearance. Okay, that's what's going on. So why do they have it? Well, let's just say it's a patient with bronchitis, and the reason that they have it is increased secretions or really thick sputum, and that's what's causing the problem with the airway. Okay, so now we've identified where our issue is. The problem is ineffective airway clearance. What's it related to? Well, it's related to the increased secretions. All right, great. All right, and how do you evidence that? Well, the person might have mucus production, thick mucus, thick sputum, that kind of thing. There's your evidence. Your evidence is everything that you see, everything that you assess, everything that you learned during that assessment class. All right, great. So we've decided what our problem is. One of the issues that I see with many students is that when they're coming up with their interventions, their interventions don't address the problem. Your intervention is something that is going to address the problem of ineffective airway clearance. Yes, there's a bunch of things you can do with a person for COPD, but you've decided to pinpoint that to ineffective airway clearance. Those interventions need to be pinpointed to that. So one of your interventions might be chest physiotherapy, okay, chest PT. All right, now your rationale for that needs to address why that works for that problem, okay? You can have 100 different interventions, but that rationale needs to tell me, as the instructor, the person grading your care plan, why it works for that particular problem, which is the ineffective airway clearance. And that's what you need to document. Those should be cited from your books. Many students go about this the wrong way. They'll come up with their care plan, then try and look it up in the book. I don't like that. I like utilize the book. As you're reading, you're going to get what you need for that intervention to apply to the problem that you're working on. In other words, answer the question. Many of my students write test questions for me without even realizing it. What they do is they give me an intervention that doesn't identify the problem that they're working up. In other words, a good distractor on an exam is a correct answer that doesn't answer the problem. So don't do that. Make sure that your intervention, the rationale, tells me why it affects that problem that you're working on, okay? Hopefully that helps, and that's just getting into interventions and rationales, and that is our bread and butter. That's what we do as nurses. Our job is to come up with interventions that address the problem. The rationales tell me why you do it, all right? If you have any questions, let me know.